Hi. Okay, so thanks for that, Tony. And I'd just like to note, actually, that Tony Walker has been instrumental in bringing the Global Resuscitation Alliance together. Both Tony and Karen Smith from AV were part of the initial group that did that important piece of work, which we're going to talk about now, back at the Utstein Abbey a few years back. So thank you so much for starting this journey. You may have noticed from the program that we've put together for the day that we're actually following the 10 steps. And what we've done is we've designed a program that looks at each of those 10 steps individually and provides a case study or some examples of how we've progressed the implementation of those. But before we get into the 10 steps, we thought it was really important just to reflect on the founding document that put us where we are today, which is acting on the call. So our original document, a call to establish a global resuscitation alliance, was where both Tony Walker and Karen Smith were involved with many of their international colleagues and experts from around the world who came up with this initial plan. Just a short while ago, in 2018, we revised Acting on the Call. We were able to illustrate within the document some great examples of where progress had been made and different organizations had looked at how they would implement the 10 steps. I think one of the fundamentals about the Global Resuscitation Alliance is that we have 4 regions. We have obviously America, we have Europe, we have Asia, and we have Australasia. And these 4 secretariats are working closely together to implement the document Acting on the Call. But equally, we are sharing our learnings as we go. The founding principle that I guess gets us up in the morning in relation to this is that we believe communities can and must do better. So our aim as an alliance is to increase survival from cardiac arrest by 50% and to educate leaders about best practice and provide the tools to them to help them improve survival rates. Now, 50% is a very courageous target, and we do recognize that at the end of the day, that's a 50% improvement on what a service is currently achieving. But, you know, inevitably, I think most of us are chasing the goal of at least catching up with Seattle, and if not passing Seattle, because I think we can. And the one thing that we do need to remember is Seattle's expertise and success, which is fantastic, is a 40-year journey. Their expertise has gone through that journey, and they've identified those 10 steps over 40 years, hence their success. So we're fast-tracking that process. We're taking the learnings from those 40 years and from the experts in Seattle and King County and have compressed that. And we really want to achieve a similar success rate in 5 years. So that's a very audacious goal, but I think we're well on the way of getting there. I don't expect you to read this slide, but what I wanted to do is just share with you the 10 goals of the GRA, which are different to the 10 steps from the Resuscitation Academy. So the 10 goals from the GRA was initially to establish a 4-continent coordinated infrastructure, hence North America, Europe, Asia, and Australasia. So that's our secretariat. And it's a pleasure to be part of that secretariat with Tony Walker. And it's great to have representatives from the Asian Secretariat and the European Secretariat here today to share their learnings. Our second goal is to promote the 10 steps to improve cardiac arrest survival. Our third goal is to promote the actions to achieve implementation, and hence the collection of case studies that we're building and including in the call to action to illustrate those. Our fourth goal is to engage communities to measure and improve by participation in an Utstein-style registry. It goes back to the fundamental. In order to improve, we need to measure what we're doing. We need to collect data, and that data needs to be comparable, or as comparable as possible. We're going to hear a lot more about data later this morning. Goal 5 is to provide a regular and repeated forum to promote both the activities of the Resuscitation Academy and those 10 steps. So as a secretariat, we are responsible for ensuring activities like today and other activities that we've put on of late, such as high-performance CPR training and high-performance telephone CPR, are provided to assist our community to make the improvements required. We need to develop a geographically diverse network that appeals across the spectrum of both community, demographics, culture, and resources. And part of that is recognizing that the ambulance service, the EMS service, paramedic services alone can't deliver the 10 steps. We need to do it with our communities. We need to collaborate with wider health. And we need to engage the public of our countries in order to make the changes required to achieve all the 10 steps and improve survival rates. Goal 7 is to develop, refine, and translate common teaching materials used to support the GRA model. And we saw a great example of that yesterday in the high-performance CPR workshop, as I explained earlier, where we could have 6 distinctly different ambulance services come together to provide training that was so slick and professional, you would have thought they'd trained together for years. And that's because as a collaboration and a collective, we've started sharing our learnings and sharing education material and getting some consistency and standardization. Step 8 is to provide regular communication and collaboration. And I'll talk a little bit more shortly about how we're going to do that and ensure that we are transparent around the successes we are seeing. We need to develop evaluation measures so we can track improvement. And finally, we need to uphold the ethos of the Resuscitation Academy, especially in our message and commitment to promote science-based quality programs. Everything we do is science-based and evidence-based to improve out-of-hospital cardiac arrest survival. So I'm going to flick through those 10 goals really quickly, just to tell you how we're doing in relation to those. So goal 1, the establishment of the GRA Secretariats. That's gone particularly well. In Australia and New Zealand, we've been on that journey since 2016. We became, the CAA was very fortunate to become the GRA Secretariat back in late 2016. And as part of that role, we very quickly started getting our medical directors and clinical leaders up through the program in Seattle and getting that baseline education in place so we could very quickly replicate those learnings across Australia and New Zealand. And now, 2018 and now 2019, all 10 ambulance services across Australia and New Zealand are fully engaged in implementing the 10 steps. They're all on slightly different journeys. They all have chosen slightly different low-hanging fruit. Some are tackling the more harder areas, but as a collective, everybody is well down that pathway. So the 10 steps are fundamental. They are the guiding document for us. And I think they will evolve over time as we learn more and more about the implementation of them. I'm not going to go through the 10 steps in detail because we will cover that throughout the day and as part of this program, and Tony referred to them previously. We're trying to have a bit of a stock take of where the different services are across Australia and New Zealand. This is a little chart that I keep and I just update regularly, and we're about to do another survey across the 10 ambulance services in Australia and New Zealand just to see where they're at in relation to the 10 steps. The first column is in relation to the registry. You know, we're really happy to report that everybody's participating in that. And as you move across the 10 steps, we're just kind of ticking off where people are at. And I think the next survey that we complete in late August, early September, I think will totally fill that whole matrix. I think we will see every aspect of the 10 steps being implemented in some way or form across all 10 services. Obviously, importantly, and one of those key goals was around the Utstein-style registry. We're so fortunate that in Australia and New Zealand we have our AusRock registry, an epistry, and it's provided an amazing data resource. And it's very pleasing to say that as of the latest collection, we have everybody participating in that now. So I don't know if that's unique as a continent to have every ambulance service contributing to a single registry. We're seeing some great progress. We're using the data from that registry, and we're using the data from the registries within each of the ambulance services to track progress. That great goal of 50% survival rate that we see from King County EMS in Seattle is one of our targets. But as we progress the implementation of the 10 steps, we're seeing survival rates across our services rise. And I'm hoping today that we will hear from a number of services in regard to how their latest data is looking in relation to survival rates and how we're seeing some significant lifts across our services. And we should celebrate that because, for every couple of % increase in survival rate, we actually are talking a lot of people. These numbers are quite significant. And these are people that are now going home to their families who perhaps would not have done previously. Providing regular forums to help the implementation of the 10 steps. So last year, we provided a couple of sessions on high-performance telephone CPR, which were really, really helpful. And we're moving more and more towards how can we adapt our current dispatching system to better accommodate what we need to achieve from the 10 steps. And the very early dispatch, rapid dispatch and telephone CPR, we need to make sure that we integrate that into our dispatching system, which is MPDS. Many of you will use MPDS. We need to ensure that we ask those questions, the no-go questions, very, very early, within those first few seconds, so that we can start responding to a cardiac arrest. The high-performance CPR training, we did a combined effort. We brought down some of the experts from Phoenix, Arizona, and some of the learnings from Seattle, and combined those into a high-performance CPR 2-day event, which we held in Sydney last year, which we had attendees from all of the ambulance services. And they've taken those learnings back and adapted them, and that's why we're seeing rollout of high-performance CPR in every single ambulance service across Australia and New Zealand now. And we know high-performance CPR is a game changer. Everybody thought they were doing great CPR, but actually what we've discovered is there's a massive opportunity to improve CPR quality, and it has an incredible effect on survival rates. We're developing a geographically diverse network. It's great that we have 10 ambulance services in Australia and New Zealand. It's a nice number to work with. I'm not envious of the US, where they've got 2,200 ambulance services to get on board. Canada has a couple of hundred. We're a bit like Europe, a bit like the UK, really, with about 10 plus a few extras. So corralling and leading the GRA initiatives across 10 ambulance services is great. And we have 10 chief executives and 10 medical directors or clinical leaders who are committed to doing this. So we have the key decision makers on board. Equally, engaging with our communities. Restart a Heart Day has become the platform for us to do that. We are having great uptake and success in the Restart a Heart Day space. This year will be our 3rd year. It'll be the 4th year for Australia because Ambulance Victoria did it in 2017. But we're seeing a doubling, approximately a doubling each year of the uptake for Restart a Heart Day. And again, this year our goal will be, hopefully, to train 50,000 people on October the 16th, just to get themselves familiar with CPR and familiar with the use of an AED. So when they're put in the position of having to do it, they have a little bit of confidence, and they are not scared to start, and they can be coached by the communication center staff. So we're developing and refining the teaching material. As I said, the high-performance CPR and the telephone CPR activities were great. We're also working with colleagues like the fire service and introducing standard practices to try and help get them on board too. And the material that we produce through Restart a Heart Day, we share with the wider community and lots of organizations who are mission aligned with us. So we're producing some standardized material, standardized learnings so that they can go out and continue to pass the word on. Being accountable and reporting, we have 5 out of 10 services currently reporting publicly. We anticipate several more services coming on board this year with public reporting, and hopefully in the not too distant future, all 10 services will be producing a public report. But as part of that, the GRA Secretariat this year is intending to produce an overall report in relation to the 10 steps, and providing that report up to the Global Resuscitation Alliance and sharing that with our 3 other secretariats. Evaluation and measures, that's a key goal for us. We're seeing lots of evaluation happening now. We're seeing some trending. We're seeing obviously the reports and the different services providing quite detailed feedback around their implementation of the 10 steps. And we're seeing bystander CPR climbing, we're seeing AED use climbing, and of course survival rates climbing. Upholding the ethos of best practice and evidence. The amount of research that is coming out of Australia and New Zealand at the moment in this space is phenomenal, and we should celebrate that. It's world-class research, and it is influencing practice around the world. And long may it last. And as we continue to collect high-quality, consistent data, the more research we'll be able to produce. So in summary, it's great to report that all ambulance services in Australia and New Zealand are committed to improving out-of-hospital cardiac arrest survival rates by 50%. All services are implementing the learnings from Seattle, but on a much, much bigger scale. All services are on the path to implementing telephone CPR and high-performance CPR. All services are looking at ways to dispatch either their community or first responders to get hands on chest and access to an AED much faster, and particularly in those first 3 minutes. All services are actively involved in Restart a Heart Day, and all services are seeing out-of-hospital cardiac arrest survival rates climb, and that is to be celebrated. So thank you all for your efforts in that space. We have many of those people who are responsible for delivering those programs in the room today, so congratulations and good luck with your work, and thank you.